Hi, I'm Dr. Genevieve Milnes from Psychology Australia. In this session I'll be discussing bipolar disorder. Bipolar disorder involves periods of elevated or irritable mood, called mania, alternating with periods of depression. The mood swings between mania and depression can be very abrupt. There's usually no clear cause for the manic or depressive episodes, but these may be triggered by life events such as childbirth, medications, sleeplessness and recreational drug use. Bob was the third child of a highly educated farmer living in Western Australia. Bob's parents had very high expectations for him and he did well during school. When he finally left home and went to university, he began to experiment with some of the usual young person vices of sex and drugs. His first year of studies was uneventful. During the second year, he became a student council member and got heavily involved with university politics. He could always be relied on to be there and get things done, but he sometimes involved himself in reckless behaviour of binge drug taking, particularly marijuana, drinking to excess and having many sexual partners. As time went by, his friends, and particularly his parents when they visited Perth, noticed that he seemed constantly agitated and hyperactive with little need for sleep. They also noticed that he was constantly talking about social assistance programs to feed the hungry in Asia, and that he seemed to be going too fast. He believed that he had worked out a plan to rid the world of hunger. This behaviour was followed soon after with depression and sadness, and he had difficulty making decisions. One night at 2 a.m, the parents received a phone call from Bob. He was speaking very fast and in a disconnected manner about all sorts of unrelated things and threatening suicide. They sensed that something was wrong. They drove through the night to get to Perth and get Bob to psychological treatment. 4% of people experience bipolar at some point in their life. It's equally prevalent in men and women and is found across all cultures and ethnic groups. The exact cause is unknown, but it does occur more often in relatives of people with bipolar disorder. That's all for this session. Thanks for listening. Remember to visit the Psychology Australia website for lots more free, helpful information and a range of online tests.